I'm a lead enterprise architect at AirLogic. My background has been, up until this point, I've worked in the financial services, and a lot of my time through my junior years was progressing through the government sectors, so DWP predominantly, and started to look at service and business transformation, strategic design, and looking at how we can use data and technology to advance how public services are delivered. So I came to AirLogic about 3.5 years ago now, and I'm taking all that experience of working in anti-money laundering and fraud and financial services and everything else to really see how we can grow and improve healthcare. It's kind of like AI is the new whiz-bang shiny, really fast, super-duper thing, right, that can send data, capture data, translate it, transform it, and do such amazing things to help us with understanding things such as screening and healthcare. And the Internet of Things have made AI and other elements really the forefront of everyone's observations at the moment, and it's really big that everyone's talking about that. But it would be a bit like trying to build a castle on a straw foundation. It's needs somewhere to go. The data and the enabling foundations underneath it have to be set up. There has to be governance. We have to understand what we are using this for. The data and the underpinning infrastructure where all of that fabulous data that's going to feed AI, that AI is going to feed back into, it has to be secure, it has to be robust. We have to know what AI is giving us in terms of data and insight, and we have to know what data we are giving to that AI to enable it to use and to continue its job. It's a two-way feed. And if both ends of those communication channels aren't fit for purpose and robust enough and secure enough and governed sufficiently, then an AI would be like putting a Ferrari in a stable. It just wouldn't work. And we really need to ensure that everything underpinning us and everything that we need to enable us to get ready, from understanding our processes, from understanding how adopting that AI is going to impact the jobs of those people, how it's going to change their ways of working, and making them suitably skilled to do it, it's not going to work otherwise. I think the fabulous thing about Wales is it's the Goldilocks size, right? It's not too big, it's not too small, and it really gives us a great placemat to look at actually getting under the skin of what all the problems and all the challenges of a true AI adoption to enable healthcare delivery are looking like. We've seen a lot of fragmented data. We're seeing lots of health boards and trusts with their own private cloud or on-prem solutions, and the data just isn't available, and it's not there, and it's not standard. It's all different people who've got different stuff in different levels of conformance or to their own governance practices and so on and so forth. And I think the real key thing that came out of Wales is a true understanding of what they want to use AI for. It's really important that we understand from Wales and in England again, is that if we just look at, here's a bit of AI, let's try and use that to address this problem, that can be great and that can work. But one of the things that came out of Wales is, let's find the use case for AI in the first instance. Let's understand what the end-to-end part of this might be that is going to incorporate that element of AI, and make sure that both ends of that are linked into it to enable that service to flow properly. Because otherwise, by adopting an AI technology, if you've not considered the rest of that service wraparound or that care pathway or that delivery system or delivery stream properly, you've got a fabulous piece of AI in the middle of it that can't interact and interoperate with the rest of that clinical pathway and that service provision. So what was one of the real things that came out of it? There's so many opportunities out there that we could use AI. Facial recognition, people walking into a hospital, or using devices and so on and so forth. But if the rest of the ecosystem isn't geared up to embed and incorporate that AI in implementation, then it's not going to work as effectively as it can, and we won't see that reduction on the resources and the people that are trying to work around it and within it, because it hasn't been thought through from that end-to-end system. And I think that's quite important, that we think about the entire use case of why we are deploying that AI, and those knock-on and the before and the afters and the ecosystem it's working within. Because, like I say, otherwise you're just going to actually end up placing extra burden on people at both ends of that, which will have a counterproductive effect. AI governance is key, right? We have to understand what parameters we want to deploy that around. We need to understand the level of risk and risk tolerance, and obviously in healthcare, risk and risk tolerance when it comes to that is very low. But we need to really be sure of how this thing is going, who's governing the AI, who is watching it, who is making sure that it's operating. And I know that human in the loop's a really big thing, but when we talk about AI, sometimes we say we don't want to use AI, it's only 85% accurate. But then when you look at when humans are doing that activity, it's only 50% accurate. You think, well, hang on, why are we then still distrusting AI when it is more accurate than the human and the more mistakes are made? But I think that's because at the moment we don't trust it, we don't understand it enough, and there aren't enough tried and tested cases of it. We have to understand what are we using it for. We've got to have assessed those risks. We've got to understand the limits of it within our use case, as I previously mentioned. But it's a people thing. Right? All of this is a people thing. If you are getting people that are comfortable and can actively and accurately use the AI tools that we are giving them, in the clinicians, in those delivering care, if they can use it effectively and competently, then it's going to be great. But there's a big upskilling there on the people as well. We've got to teach them how to use these things now. We've got to teach the people that are interacting with both people and the systems how to do that effectively and how to have those conversations, because the public aren't very trustful of AI at the moment. We see too many things with the AI scams. I think there is a general uneasiness. I think you've got the two camps of those that really want to adopt it and get going with it, and then we've got those that are so nervous and reticent. And we've got, if we look at the society as it goes, we've got both ends of the spectrum. You've got, the elderly and all of those technologies advance so much within their lifestyle that they're still nervous of all things, even like maybe an Apple Wallet or what have you. So actually having an AI helping, and they know that a robot's or in their head, help deliver their care, that's going to be hugely nervous. So I think the messaging around it has got to be really key and really strong. And we've got to be open and transparent about what it's being used for and why and what that means to them. It's keeping the people, patient-centered all the way. It's letting them know that if we use these tools in these ways, that means this to you. That means your waiting times are reduced. That means your outcomes will be better. And I think it's going to be a huge PR campaign. I think the messaging, the conversations that need to happen with all walks of life, you've got the digitally poor and all the rest of it that actually don't understand too much around how these things are going to work and affect them. And I think it's really scary for people at the end of the day. And I think that's going to be the biggest challenge for the NHS is making people comfortable with it. And the only way they can do that is by being transparent, but they need to be bold, and they need to start to move it if they're really going to address some of the big challenges that are hitting the NHS at the moment. I think AireFest is a fantastic event. I think it's unlike a lot of the conferences that you go to where you've got the stands and where people are trying to sell stuff to you all the time. And that's not what AirLogic is about. AirLogic recognises that the answers to the NHS's challenges, the answers to how we deliver tech for good outside of that aren't just in one person's head. They aren't just in one organisation. It's only by coming together and having some really difficult conversations in a safe space where we can bounce some ideas off and understand that actually we are going to need to come together as a community of digital providers, as a community of people working with clinicians, working with those people doing research and analytics, and all of the nurses delivering care, everything across the spectrum, getting everybody together to really tackle some of these challenges. And that's what AireFest's brought to me, and that's what I've seen around is lots of people bringing use cases and stories about the challenges, and but have you thought about, and well, what about that then? I see where you're coming from. And it's that freedom that, there's no egos, nobody's role's more important. It's all about opinions and how can we make this better? And that's what I think AireFest's actually achieved. I've heard so many great conversations around it.